Hi, my question has to do with what possibilities beside the slow process of growing collaterals would there be if I have a totally blocked left iliac artery, a stented right iliac artery, and now a totally blocked fem to fem bypass with some blockages beginning to start in the legs?
Okay, and sorry to ask you, which are your actual symptoms now?
Some discomfort at night when I'm sleeping, aching legs, and of course, when I try to walk, I get pain. Mostly it starts in the lower back, the glutes, and the hips. And it's been like that for a few years now. I was told that the only option when things got bad enough would be to have a procedure that almost sounded like what Douglas had, where there would be a graft that would go from up in the shoulder area.
The axillary bifemoral
Yes.
bypass. Where are you located, Carmela? Have we talked before?
Yes, I'm near Harrisburg, Pennsylvania. So
okay.
I have a doctor in Camp Hill.
Okay, that's Dr. Raj Dave.
Yes.
Okay.
Okay, so I mean, listening to what you say, that's important that you mentioned the buttock pain, for example. So the buttock pain, you think that every single, let's say, segment of our arterial tree can give you different symptoms. Whenever you have a blockage in the iliac artery, especially the common iliac artery, which is exactly the branch which comes out from the aorta, then also, this branch, the common iliac artery, divides in two other branches. One is the internal iliac artery, and the other one is the external iliac artery. The external is the one then going to the femoral and down to the, let's say, with different branches to your foot. The internal is the one which is going to your pelvis and to your buttock. So there's an anterior branch for your pelvis and a posterior branch for your buttock. When people come to me, and actually not only to me, to everyone, and have this kind of pain in the buttock, which starts, that means that, straight away, without even doing a CT, I'm not a magician, but I can tell you that you have some common iliac disease. Because whatever is below the iliac bifurcation, like internal with external, then we'll just take your leg. But whatever gets to the buttock, that means that it's involving the common iliac artery. So as you said, you have a blocked common iliac artery, and you said that on the other side you have a stented one. Just yes. My question is the stented one patent or not?
It is open.
It is open. So is your pain in the buttock on which side? Only on the part which is stented, or on which part?
Both.
Both. So that's curious, because I mean it looks like something that could also be not related to the P.A.D. And did you have a CT scan at all?
Yes, I recently had a heart scan.
CT scan of the lower limbs.
Yes, they did that.
Okay, because that's important to understand, because if you have a stent which is patent on one side, on the other side you have occlusion, I expect you to have different symptoms on, between two sides. Of course, your pain in the night, is it on both legs?
Yes, and I think that's because that femoral bypass is now blocked.
The fem-fem?
Yes.
And the fem-fem, oh, I understand. Okay.
That was done back in 2004. Okay.
Yeah, I mean, for example, to be completely honest with you, usually more or less all iliac occlusions can be recanalized. And actually, it's better to have that before having a fem-fem bypass, where both groins you have surgery. And I personally like to try my best to recanalize the iliac arteries. Anyway, no matter what, but you have this kind of blockage. And now, do you have the possibility, did you see anyone to try to unblock your blocked iliac artery or not?
I was told that it's not possible to get through the left artery that's blocked. And the vascular surgeon that I saw was the one who mentioned doing that procedure that's similar to what Douglas had.
Yeah, I'm thinking
Okay.
that we need a different doctor. I just messaged you, and I think Lorenzo will agree. I think we need a different doctor to give you
No, I
another.
definitely think that I really want, I mean, to be honest with you, I can't recall an iliac occlusion I couldn't cross and
Yeah.
treat. And actually, usually these common iliac artery or, iliac artery is treatment, they're usually quite good because usually the vessels are quite big and the stents tend to keep patent for longer compared to like the thigh. And I definitely think that you deserve someone who can open this artery. In the meantime, I would like you to also to understand if your problem on the side where the stent is patent is related to P.A.D. Because if you have, then maybe there's some other blockage down there. But if you feel, you said that you have rest pains, you have pain in the night on both sides, am I right?
Yes.
And did you do ABI?
I don't know.
Okay, because it would be nice to understand more if the pain on the right, I think, where the stent is patent, if that is correlated to vascular or not. What do you do in the night when you have this pain? And that's an important question.
Usually I would take some Tylenol to try to alleviate the pain, but mostly it keeps me awake most of the night.
Okay, do you do anything in particular? I'm talking physically.
Get up and walk around.
Okay, yeah, that's you see, that's the question that needs to be answered, because I mean, people who don't have arterial disease, it's very simple. When you stand up, the gravity helps you in getting more blood flow down to the toes. So whenever instead you are lying, this kind of gravity effect is not there, so that's where you develop the pain. So if the answer to my question for my patients is I put the leg outside from the bed or I try to walk around, that's the right answer to for me to understand that it is a proper vascular problem. If you say, for example, no, I move in the bed, I massage, I try to change position, that's not really possibly vascular. So, but if you say that you wake up, you try to walk around, you try to put the leg outside from the bed, that's a sign of vascular disease. But I would like you to be investigated. So the thing is, for the left side, the one which is blocked, you need to find someone to unblock it, 100%. On the right side, you just need to be investigated a bit better in order to understand if your disease is properly vascular. This is what I suggest you to find a doctor which does these two things. Check on one side and treat the other side.
Okay, thank you.